Okay, trigger warning for you. This is a needle. I'm gonna put it in my leg. Cool? Cool. I'm not cool with that either, but, you know, worth it for me. You know, I'm crazy, but not for this. Crazy for a lot of other reasons. Not crazy for being trans. This is a really important life-saving and many times medication. Definitely life-changing for me, and something I really am very happy to have the privilege of being able to access. So it's my 3rd week on testosterone, which means it's my first time administering my shot to myself. And I'm a little nervous when it comes to needles, so I thought that I would record myself doing it so that it wouldn't get too in my head about it all, which sounds weird, but for some reason it seemed like less nerve-wracking of a thing to do for an audience than just alone for myself. Getting terrible glasses glare. Take those off. I can still, no, I can't see without them. So I haven't really noticed any changes really yet. I mean, like, my skin and hair feel slightly different, but that might be all in my head, because definitely there's like a lot of, I think, like placebo effects where like I'm like really happy and excited to be like on this journey, so I just feel different emotionally because of being happy. So yeah, and I've also like really, I started working out recently, like a week before I started T. I started like putting an effort into like exercising for the first time in a long time. I felt like comfortable enough in my body to do that and feel like I deserved that, I guess. So I've noticed like I'm getting more muscular, but that's because I'm working out, not necessarily because of the tea, but inspired by the tea maybe, I don't know. And like I stopped shaving my face right when I started tea, and I'm like, I'm not gonna do it because I want to monitor the changes in maybe facial hair growth. I know that that's a long time coming, so I don't know. It's crazy because I feel crazy. I'm like, is this different, or am I just am I just hyper focused on these things and they're not really that different? It's just me thinking about them more. I don't know. So I got all this stuff laid out here. So the first thing you're definitely gonna want to do is hand sanitize. Some hand sanitizer, make sure everything on your work area is super clean. So I have this system that I sort of worked out with my nurse where I like mark the bottle. You can see like when I took, I should probably hide more of this, but you can see that I've marked the bottle where I've taken what dates and how much I took from the bottle. You should be able to get like 3 or 4 doses out of a bottle. That's what they told me. But I just wanted to make note like of like how much came out and what leg. So I started with my right knee and then I moved on to the left. And so you can, by the way, do it on skin with tattoos. I definitely made sure to ask about that. But now it's my right side again, and you can't see at all. I think it was like somewhere right here where it went in last time. The mark is completely gone, so I definitely don't know where it went in last time, but I'm gonna try and, you know, put it somewhere where it wasn't before, maybe. I don't think it really matters much of a tattoo up here, but it's gonna be much lower in my leg. It doesn't really matter where you put it, like, because it is subcutaneous. It's not like an intramuscular injection. It doesn't matter where necessarily on the thigh you put it. And I do my thigh. Some people put it in their butt, but they taught me how to do it this way, and it's only my first time, so I'm gonna do it the way they taught me to do it, which is on the thigh. So I'm gonna, you know, really sweaty hands. It's like my number one thing. I'm worried about like dropping something because I'm so clammy all the time. Just gonna make sure to keep hand sanitizing throughout the whole process. I try to have some slightly dry hands, even though that is hard for me. Oh, you like my socks? I didn't know if my feet would be in this. I put socks on, even though I don't usually wear socks in the house. I didn't need to show you guys my feet for free. It's not in my butt. Okay. I'm also talking in a weird volume, so I didn't want to be like, hi, I'm Sidney, 3rd week on tea. That seemed really stereotypical, so I thought I would not say those things, in the beginning at least. I'm stalling. So, got your tea, and comes in like a little bottle like this, and I've already, you know, taken tea out of this one, but it reseals every single time, which is nice. And you can see, are they gonna focus? There's still some fluid in there, and I'm definitely gonna have enough for today's dose. I'm not sure if I'm gonna be able to get a 4th dose out of the same vial. They told me not to mix the vials. Like, if you can't get enough out of the first one, don't go into the second one to get more. Like, that's not a good idea. So definitely 3, but maybe not 4 doses from the same vial. So the first thing you want to do is take out one of your little alcohol pads, and she brought the trash can over here earlier. What you're gonna want to do is wipe the whole leg, because you don't really necessarily know where you're gonna put it when you actually go to do it. So you want to wipe down the whole, just to be safe, the whole thing. I don't really know how to sit so that my leg is relaxed. I feel like being relaxed is like important, because when you're tenser, it hurts more, I've imagined. So how do you sit and be relaxed? Moving everything on my counter, kind of like get it all chill, fatty. Don't flex. Still so much glare. You can see how like red I am because I'm like nervous. I'm getting flush. Okay. Don't touch it when you cleaned it, even though you're keeping your hands clean. The hand sanitizer the whole time. Clean hands are important. Okay, I threw away the alcohol wipes, so I'm gonna get another one. You don't have to, you can use the same one. So you're gonna wanna take your little tea. Calm it down. Take this little alcohol square. You're gonna want to like wipe the top of the container. So for the needle, you're gonna have a little syringe, and you're gonna have 2 different needles. So it works like gauges. So the larger number is a smaller needle, and you're gonna want to use the smaller needle to go in your body, and a larger needle to go into the tea to draw up the medicine. So the larger needle is the smaller number. So 21 and 25 is what I was given. So 21 is actually a bigger needle than 25 gauge needle. So the bigger needle goes on the syringe first to draw up the medicine, and then you take off the bigger needle, put that in your handy dandy sharps container, and then you put on the smaller needle and inject the fluid into your skin with the smaller needle. So smaller needle is a bigger gauge. So the 21 gauge is bigger than the 25 gauge, even with a smaller number. It's also much longer of a needle than the needle that's going to go into my skin, and that's the second number. So this is a 5/8 inch. It's going to go into my skin, and the 1 is going to go into the bottle, which is good because I don't want a long needle in my body. I'd rather it go in the bottle. So, and I'm getting so sweaty, just like so sweaty, and I'm like so nervous, and sweat is sterile, so it's fine. I gotta keep telling myself, it's fine, everything's fine. So she taught me to rip it all the way off so that you can still like, it doesn't like bounce around as easy. Dry the hands. So we're gonna take this nice long, take the longer needle, the thicker gauge, and you're just gonna wanna twist it right on, nice and tight. Yeah. Like that. Take the top right off, and what I don't want to do is you're going to want to draw in a little bit more air than what you're actually going to need. So I take 2.5, so I'm going to draw in 3.3, 0.25, so I'm going to take 0.3 of air, and you do that because this is a vacuum sealed medicine bottle, and so you're going to need to put air into it to get anything out. So once the needle is inside, you're going to want to pull the needle out until it's submerged in the liquid. Forgot to plunge it, let my air in there. So now that it's submerged in the liquid, I'll be making sure that I'm only getting liquid out. Push the plunger down, only liquid and not air is coming into the syringe. And it doesn't really matter if you do get an air bubble in there, because air bubbles aren't the problem here. Funnily enough, it seems like all the time in needles you hear air bubble is bad, but in this case, not really that bad. It's hard to pull it because it's such a thick, viscous fluid, and like an oil. Tease, like in an oil. Draw a little bit more than what you should need. You might have an air bubble, so just a tiny bit more. Then, whoop, good. Flick that down so then that needle is safe. Okay, so now I have my 0.25 of testosterone in there, and it's maybe like 0.26, maybe a little bit more. And it doesn't look like I'm going to be able to get another dose out of that, honestly. So next time I draw, I'll draw from a new vial completely, because you can't go into the same vial again. I'm gonna save this just in case. So now I'm gonna got my band-aid ready. I have to rewash my thigh, I think. It's probably not the cleanest method of opening the bag. I want to get my little gauze out too. It makes me feel weird just like holding it out. I know that a different needle is gonna go on it, so it won't be bad, but just like the thought of having something out in the air for this long is scary. I like want to go faster, but I know I shouldn't. I should stay going slow. Okay. Get that guy all cleaned up again. Pull the pants up. Okay, so it's like a twist this off, put it in there. I should have opened this already. Just that on. nice and snug. Okay. My band-aid's ready, everything's ready. Now, nothing to it but to do it. And I'm still scared to do it even though I want it. It's like really thick, so it's kind of like hard to squeeze out. That's kind of like the hardest part for me, is like to hold it and squeeze the fluid all the way out. I got my sharps box here, my gauze and my band-aid, and I'm all ready. The nurse told me, like, if you just like go right in, it's kind of hard, but if you kind of have something to like brace yourself on before you put it in, that makes it a little easier. And I like to like put it in with my left hand and then squeeze it in with my right hand, because I'm a righty. I don't know like why, it just seems easier to do the hard part with my hand that I'm most dominant with. And it's not like that hard, but it does kind of take a little bit of force, more than like someone who does like insulin would is be like a less viscous of a thickness of a liquid. So it's easier to squeeze in than like testosterone, because it's in an oil. It's kind of hard to plunge the plunger. So I'm like nice and relaxed, and you have to pinch for intramuscular. You don't really have to pinch for subcutaneous. You just put it in like this. And I still have the safety on right now. Actually, it helps to meditate. I don't even have that much shot anxiety. I just am a bitch. Okay. Doing it now. Plunging is the hardest part. Whew, see? Took me a lot longer to press the plunger than to even get it in, and it doesn't even hurt, but for some reason I always think it's going to, and that's because we are afraid of needles as human nature. I want to close this every time. I'm afraid that it's not going to open again, which I know is stupid of me. But I think you're only supposed to close it when you're done. Applying a little bit of pressure. It doesn't usually bleed or anything. Sometimes a little bit of the tea can come back out. There's a little bit of blood. I got my band-aid here, and it is actually a Captain America band-aid, so I'm a happy boy. My cutesy little band-aid, and because there's not a lot of blood, you can totally use a teeny little cutesy band-aid. If you want to see the little dot that's on my leg, you can see, you can barely see the little dot. I can see it though, so I'm gonna put the band-aid right on. Is that Captain America? There's a Hulk fist there too. I guess it's maybe just the logos. But it's still more fun than like a plain old band-aid. And yeah, so now I got my needle and the sharp box. I can put leftover tea and everything back in my handy dandy little medicine bag. And that's it. Quick and easy shot day routine. And now I'm gonna treat myself and celebrate the fact that I can do this for myself and feel, I don't know, I feel super independent about it. Being able to administer your own medicine is really awesome, and I never would have thought that it was possible, like, even a couple months ago, to be, you know, like self-administering an injection of testosterone, like doing the thumbs up plunge. But yeah, just more good feelings than anxiety overall, for sure. So thanks so much for watching, and I'll see you next week, every week, for the rest of my life.